Let's take a look at Chapter 13, the endocrine system. So the related combining forms for this chapter: adrenal glands, adreno, gonads, gonadal, male is testicles, testicle, female ovaries, ovario, pancreatic islets, pancreatal, parathyroid glands, parathyroid, O, pineal gland, pineal, pituitary gland, pituito and pituitarial, thymus is thymo, and thyroid gland is thyro and thyroidal. So the function of the endocrine system, it's a production of hormones that work together to maintain homeostasis. The hormones are chemical messengers secreted by endocrine glands directly into the bloodstream, reaching target cells and organs. It regulates activities of specific cells and organs. The endocrine glands, they do produce hormones. They are ductless. You can put the term here, endo is within, and crine is to secrete. So endocrine means to secrete within. There are 13 major glands: 1 pituitary gland, 1 pineal gland, 1 thyroid gland, 4 parathyroid glands, 1 thymus, 1 pancreas, 2 adrenal glands, and 2 gonads. You can see here the structures of the endocrine system. So here's the pineal gland, the hypothalamus, pituitary, thyroid. Here's your parathyroid glands, the thymus gland, adrenal glands of your kidneys, the pancreatic islets, the ovaries in the female, and then the testicles in the male. So these are the structures of the endocrine system. So the first gland we're going to talk about is the pituitary. So this is located below the hypothalamus in the brain. There are 2 divisions, anterior and posterior lobe. It does secrete hormones, control the activity of other endocrine glands, and also the response to stimuli from the neural hormones to maintain appropriate levels of hormones. So you can see here the pituitary gland, the anterior and posterior portion. Hormones are often referred to by their abbreviations. We'll explain on the next few slides. So the first one we have is the adrenal corticotropic hormone, the ACTH. This stimulates growth secretions of the adrenal cortex. Then we have the follicle stimulating hormone, the FSH. This stimulates secretions of estrogen and growth of ova in the ovaries of females, and it stimulates production of sperm in the testicles of the males. Next, we have the growth hormone, the GH. This regulates growth of bone, muscle, and other body tissues. Then we have lactogenic hormone, the LTH. Stimulates and maintains secretion of breast milk in mother after childbirth. Looking at the term lactose milk, Jeanne is producing. Then we have the luteinizing hormone. This is LH. Stimulates ovulation in females. And also stimulates secretion of testosterone in males. We have the melanocyte stimulating hormone, the MSH. This increases production of melanin caused by darkening of skin. We have the thyroid stimulating hormone, the TSH, stimulates secretion of hormones by the thyroid. We have the antidiuretic hormone, the ADH, secreted by hypothalamus and stored in the pituitary gland. This hormone helps control blood pressure by reducing the amount of water excreted through the kidneys. We have the oxytocin, OXT. This stimulates uterine contractions during childbirth. It does control postnatal hemorrhage, and it stimulates flow of milk from the mammary glands. Oxytocin is labor. We have the pineal gland. This is located in the central portion of the brain. The functions and secretions. It secretes secretions influence sleep wakefulness cycle, also called circadian cycle. Melatonin is a hormone responsible for this cycle. Here you can see the pineal gland. Here's where this is located, right here. And then we have the pituitary gland, and then the hypothalamus in these areas here. We have the thyroid gland. This lies on either side of the larynx, just below the thyroid cartilage. The function of the thyroid gland then is to regulate body metabolism. It also influences growth and functioning of nervous system. Secretions, there are two primary hormones. We have the T4, thyroxine, and then we have the T3. The two primary hormones regulate metabolic rate and affect growth and rate of the function of many body systems. The rate of secretion of these two hormones is controlled by TSH, produced by anterior lobe of the pituitary gland. Continue with the secretions of the thyroid gland. We have the calcitonin. This works with parathyroid hormone that decreases calcium levels in the blood and tissues by moving calcium into storage in bones and teeth. So we have four parathyroid glands embedded in the posterior surface of the thyroid gland. So the functions, they regulate calcium levels. Secretions are the parathyroid hormone PTH. Works within calcitonin to regulate calcium levels in the blood and tissues. And you can see here where these are. We have the parathyroids here. Here's the thyroid, orange. We have the thymus, and then we have the heart here in this figure here. Next, we have the thymus. This is located near the midline in the anterior portion of the thoracic cavity. It's posterior to the sternum and superior to the heart. So the functions of the thymus, it helps develop immune system before birth and in childhood, and it also reduces the function after puberty as it turns into fatty tissue. Secretions would be the thymosin. This stimulates maturation of lymphocytes into the T cells. The pancreas functions as a part of the digestive as well as the endocrine system. The pancreatic islets have the endocrine functions. So the functions of the pancreatic islets, they control blood glucose levels and glucose metabolism throughout the body. The secretions of the pancreatic islets include glucose. This is a basic form of energy used by the body. We have glucagon. This is a hormone secreted by the alpha cells in response to low levels of blood glucose. And it also increases glucose level by the stimulating liver to convert glycogen into glucose to be released into the bloodstream. We have insulin. This is a hormone secreted by beta cells in response to the high levels of blood glucose. It does allow glucose to enter the cells to be used as energy, and it also stimulates liver to convert glucose into glycogen for storage when additional glucose is not needed. So the adrenal glands, they are located at the top of each kidney. We have the adrenal cortex, which is the outer portion, the adrenal medulla, which is the middle portion. As you can see, here's a figure of this. One adrenal gland is located on top of each kidney. Each adrenal gland consists of the adrenal cortex and the adrenal medulla. So here you can see the kidney, adrenal gland. Here's a capsule. Here's your medulla in here, which is the middle layer. And then here's your cortex, which is the outer layer. The functions of the adrenal glands, they control electrical levels within the body. They help regulate metabolism, interaction with sympathetic nervous system in response to stress. Androgens are the sex hormones secreted by the gonads, adrenal cortex, and fat cells. We have corticosteroids, steroid hormones. Aldosterone regulates sodium and water levels by increasing sodium reabsorption and potassium excretion by the kidneys. Cortisol has the anti-inflammatory action. Secretions of the adrenal medulla. Epinephrine. This stimulates sympathetic nervous system in response to the physical injury or mental stress. We have norepinephrine. This is released as a hormone by adrenal medulla and as a neurohormone by the sympathetic nervous system. Let's take a look. Gonads are gamete-producing glands, ovaries in the females, testicles in males, and then gamete just means reproductive cell. The functions of the gonads, They secrete hormones responsible for development and maintenance of secondary sex characteristics that develop during puberty. Puberty then is just like physical changes by which child's body becomes adult body capable of reproducing. Secretions of the gonads, we have estrogen. This is secreted by the ovaries. We have progesterone. This is released during second half of the menstrual cycle. We have gonadotropin. This is any hormone that stimulates the gonads. Androgens, this is primary testosterone. This is secreted by gonads, adrenal cortex, and fat cells. It does promote development and maintenance of male sex characteristics. We have testosterone, steroid hormone secreted by testicles and adrenal cortex, stimulates development of male secondary sex characteristics. And then we have estrogen and testosterone are present in males and females, both, but in different amounts depending on the gender. Specialized types of hormones have different chemical structure or are not secreted by endocrine glands directly into the bloodstream. Steroids, these are secreted by endocrine glands, are artificially produced as medications to relieve swelling and inflammation. We have anabolic steroids. These are man-made substances chemically related to male sex hormones. They are used to treat hormone imbalance in men and to help the body replace muscle mass caused by disease. They may be used illegally by athletes to build muscle mass. We have leptin. It's a protein hormone involved in regulation of appetite. We have ghrelin. This is produced in the GI tract. It's referred to as the hunger hormone. Neurohormones then are produced and released by neurons in the brain and delivered to various organs, tissues throughout the bloodstream. Let's take a look at some medical specialists related to the endocrine system. The first one we have was endocrinologist. This is a specialist in diagnosing, treating diseases and malfunctions of the endocrine glands. We have certified diabetes educator, someone that's qualified to teach people with diabetes to manage their disease. We have the pituitary gland. Let me go back one. Did I? No, okay. Okay, I thought I missed one, but I guess I didn't. Pituitary gland, let's take a look at some of the terms we have here underneath this. So the first medical term we have is acromegaly. So looking at this term, acro means extremities, megaly is enlargement. So it's enlargement of the extremities. Gigantism, this is an abnormal growth of the entire body. It is caused by excessive secretion of growth hormone before puberty. Underneath the pituitary gland, we have hyperpituitarism. This is just excessive secretion of growth hormone, which does cause acromegaly and gigantism. We have short stature. This may be due to deficient secretion of growth hormone. We have pituitary adenoma. It's a slow-growing benign tumor of the pituitary gland. The short stature would also be known as dwarfism. Galactorrhea, excessive prolactin causing breast to produce milk spontaneously. We have prolactinoma. It's a benign tumor for the pituitary gland. Looking at the term, pro is on behalf of, and then lactin is milk. The antidiuretic hormone conditions. Let's take some look at some of these terms. Diabetes insipidus. This is too much fluid is secreted in the kidneys. We have a syndrome of inappropriate antidiuretic hormone. This is overproduction of ADH, and this leads to water retention. We have pineoma. This is a tumor causing disruption of the production of melatonin. We have thyroid carcinoma. This is the most common cancer of the endocrine system, and it does affect more women than men. We have Hashimoto's disease. This is an autoimmune disease, and this is where the body's antibiotics attack and destroy cells of the thyroid gland. Hypothyroidism. This is just a deficiency of the thyroid secretion. Cretism. This is a congenital form of hypothyroidism. We have myxedema. This is extreme deficiency of thyroid secretion in the adults. Thyroid storm. This is a life-threatening condition due to exacerbated hyperthyroidism. We have hyperthyroidism. This is just overproduction of the thyroid hormones. It does cause imbalance of metabolism. Graves' disease, this is a disease that attacks immune system. It attacks the thyroid gland, stimulating the production of excessive amounts of thyroid hormone. Goiter, a few terms underneath this one. Goiter is just a swelling in the front of the neck. It's an abnormally benign enlargement of the thyroid gland. We have exophthalmos. This is an abnormal protrusion of the eyeball out of the orbit. Hyperparathyroidism. This is overproduction of parathyroid hormone, which leads to hypercalcemia. Hypercalcemia is just abnormal high concentration of calcium circulating in the blood instead of being stored in the bones and teeth. With hypoparathyroidism, this is an insufficient secretion of parathyroid hormone, and this causes hypocalcemia. And your hypocalcemia means abnormally low levels of calcium in the blood. Thymitis, inflammation of the thymus gland. Itis is your inflammation, thymus is your thymus. Moving on to the pancreas, some of our terms. We have insuloma. This is a benign tumor of the pancreas, and it does cause hypoglycemia by secreting additional insulin. We have pancreatitis. This is inflammation of the pancreas. It's often due to long-term alcohol abuse. We have hyperglycemia. This is abnormally high concentration of glucose in the blood. Glyc is sugar. Polydipsia, excessive thirst. Dipsia is thirst. Poly is many or much, excessive. Polyphagia, excessive hunger. Phagia is eating. Polyuria is excessive urination. Uria is urination. Hyperinsulinism, excessive secretion of insulin in the bloodstream. Then we have hypoglycemia. This is abnormally low concentration of glucose in the blood. So diabetes mellitus is the most common endocrine system disease. They are classified type 1, type 2, or type 1.5. We'll talk about each one of these. So the first one, type 1, is an autoimmune insulin deficiency disorder. It's caused by destruction of pancreatic islets beta cells. And the treatment by diet, exercise, and insulin replacement therapy administered by the injection or an insulin pump could also be used. Type 2, insulin-resistant disorder. This is insufficient use of insulin by the body. Patient may be asymptomatic for years. Treatment, diet, exercise, and oral medications for type 2. And then we have the type 1.5 diabetes, development of type 1 diabetes in adults. And it does share the characteristics of type 2, but with autoimmune bodies. This often occurs in adults of normal weight and family history of type 1 diabetes. Treatment, diet, exercise, oral medications, and insulin for this type. We also have gestational diabetes mellitus. This occurs during some pregnancies and usually disappears after the delivery. We talk about some diabetic emergencies. A person can go into a diabetic coma due to hyperglycemia. Could go into insulin shock due to hypoglycemia. Diabetic retinopathy. This is damage to the blood vessels in the retina. Also can have heart disease. This is where the walls of the blood vessels become rigid. Ketosis. This is high levels of ketones indicate insufficient production of insulin to convert glucose to energy. And then kidney disease, also due to damage to the blood vessels and reduction of blood flow to the kidneys. Peripheral neuropathy is another complication. This is damage to the nerves affecting hands and feet. Causes slow wound healing. Adrenal glands, some of the things they list here. We have Addison's disease. This is where adrenal glands do not produce enough cortisol or aldosterone. Adrenalitis is inflammation of the adrenal glands. Aldosteronism, oh boy, I can't say that term. This is electrolyte imbalance due to excessive secretion of aldosterone. Next, we have Conn's disease syndrome due to excessive production of aldosterone. Next one we have is pheochromocytoma. This is a benign tumor of the adrenal gland causing high amount of secretions of the epinephrine and norepinephrine. You can see, looking at this term, pheo is dusky, chromos color, site cell, oma is tumor. Next, they talk about the Cushing syndrome. This is a prolonged exposure to the high levels of cortisol. It may be due to body's overproduction of cortisol or by prolonged use of corticosteroids. We have hypergonadism. It's just hypersecretion of the hormones by sex glands. We have hypogonadism. It's hyposecretion of hormones by sex glands. We have gynecomastia. This is excessive mammary gland development in males. Some diagnostic procedures related to the endocrine system. From the thyroid gland, we have the radioactive iodine uptake test with the thyroid stimulating hormone assay, with the thyroid scan. Underneath diabetes, some diagnostic procedures. We have fasting blood sugar, oral glucose tolerance testing, hormone or home blood glucose monitoring. You monitor yourself at home. We have random blood glucose test, hemoglobin AC1 testing, and fructosamine test. Underneath the pituitary gland, we have human growth hormone and hypofixectomy. There you go, hypofixectomy. It's just a removal of the abnormal glandular tissue. You can see how it's broken down here. Hypos is pituitary, ectomy is removal. Pineal gland, pinealectomy is just a surgical removal of the pineal gland. Looking at the thyroid gland, they could be an anti-thyroid drug, radioactive iodine treatment. A lobectomy would be surgical removal of one lobe of the thyroid gland. Synthetic thyroid hormones. This is an oral medication for the replacement of the thyroid function. We have parathyroid glands. We have parathyroidectomy. This is surgical removal of one or more parathyroid glands. The thymus. Surgery could be thymectomy. It's a surgical removal of the thymus gland. Pancreas, pancreectomy, surgical removal of all or part of the pancreas. Then we have a total pancreectomy, treatment for pancreatic cancer. This would involve removal of the spleen, gallbladder, common bile duct, and portions of the small intestine and stomach. So it's called a total pancreectomy. Underneath the adrenal glands, we have laparoscopic adrenalectomy. This is surgical removal of one or both adrenal glands. And we have cortisone. This is administered to suppress inflammation or as an immunosuppressant. And that's it for the chapter. So please go to your workbook and complete the exercises for the chapter. And thank you for listening.